Hey guys, welcome back. It's kind of a rainy day outside, and don't mind me, I don't have any makeup on today, but it's kind of rainy, so I'm gonna go to a coffee shop and try to study for NCLEX. So you guys can tag along today, and I'll talk a little bit about what I'm using to study for NCLEX and how I'm studying for NCLEX. So hope you enjoy today's vlog slash tips video. So I'm using these flashcards by Barron, and I don't remember what the edition is, but I'll put a link in the description box below. But they're just really simple. They give you the question, the answers. Some of them are select all the applies, some of them are just a singular answer multiple choice question. But then what I really like about them is that it gives you the answer and it gives you rationales usually along with why each question is right or is incorrect. So that's what I really liked about that. So I'm just going to start out with these. As you can see, I'm already part of the way through. It did not come with these little rings, so I put the ring on it just so that I can flip through them easier and they don't get all jumbled up in my bag. So I don't know about the rest of you guys, but my school uses ATI. Some people use HESI. But I've been going back through all my old ATI textbooks and been doing the exercises in the back of each chapter. So this one's the pharmacology one because I've been struggling a little bit with pharmacology and remembering all my meds and just basic things to remember, like which ones should not be given to pregnant women and which ones you maybe need to stay out of the sun, and then also the endings for them. So like you think about your beta blockers all end in LOL, and ACE inhibitors end in PRIL. So I'm just going back and refreshing my memory. I also have the MedSurge textbook too for ATI, which I've been using that one a lot. But my MedSurge skills are still pretty decent, so I'm just reviewing Pharm for now. There's also one for children, like peds and OB, which I'll be reviewing at some point too. Peds I do a little bit better with, but OB I definitely struggle with. So I just find these really helpful because it just kind of summarizes everything for you. It gives you like a summary of what the disorder is, if you're talking about disorder or drug, and then the types, what they're used for, complications, and then in the back you can go over the practice questions, which I find super helpful. So the last thing that I've been doing is I've actually been watching all these NCLEX prep tips on simple nursing, and I just find them super helpful. Like if I get a couple questions in my flashcards or online about stroke or meningitis or something, this guy has a ton of tips for that, and it just kind of simplifies things for you. So I find that very helpful. I am not going to do one like giant review. I am honestly just going to brush up on the things that I don't remember, especially like ABGs. That's a big one that'll show up on NCLEX. And then I've just been writing down my notes, and ignore the fact that my notes aren't the most pretty, but these are some of the things with relation to antibiotics that I'd forgotten about and that I was wanting to brush up and that were on this YouTube channel. So for example, I do really well with mnemonics, so the fact that child care and penicillins, making some coffee. The fact that child care has 2 C's in it reminds me that penicillins and tetracycline or doxycycline are bad for women who are pregnant. And then something like this was also helpful, where move the food. I can remember that off the top of my head pretty well, and it reminds me that macrolides, tetracyclines, and fluoroquinolones should not be taken with food. I will also be working on this today. I finally got my NCLEX application, and this is to apply for NCLEX and my nursing license. So I will be working on that today and filling it out. I know that I need to get the form notarized when I'm done filling it out. There's like a page in there that I need to not fill out prior to getting it notarized, and then I also will need to go and get fingerprinted. So those are some things that you want to think about that you'll need to do before taking your NCLEX. You have to get fingerprinted and you have to fill out some paperwork, and usually your school will be the one to submit all your stuff for you, like your transcript. So obviously there's a lot more to study for NCLEX than just what is on this little list that I have right here, but I thought I'd just go over it with you guys really quick. This is what I plan on studying and refreshing my memory on. So antidotes to medications is one. So things like the antidote for warfarin would be vitamin K, and you would need to remember that a patient on Coumadin or warfarin cannot eat leafy greens, so you might want to brush up on, you know, what counts as a leafy green. Other antidotes would be like Narcan if somebody has an opioid overdose. Normal lab limits, make sure you know those, and make sure you know the lab values that NCLEX wants you to know, because they're a little bit different. I found with each class, like one professor had a set of values, and then at the hospital the lab values might be a little bit different. So make sure you know what NCLEX wants you to know. How to read arterial blood gases, that's super important. You need to know the signs and symptoms of metabolic acidosis, respiratory alkalosis, and things like that. Vital sign limits for children and infants. This is something that I forget. It's not that hard to grasp the concept of, but I forget it a lot, and it pops up on a lot of questions I've been finding out. So vital sign limits for kids and infants are usually higher. So like heart rates will be higher, respiratory rates will be higher. So a respiratory rate of 12 for a kid who's, let's say, getting morphine following surgery might actually be bad. It's actually a low respiratory rate. And then electrolyte imbalances, this is something that I struggle a lot with. So you think about hyperkalemia, too much potassium, too low potassium in the body. How is that going to affect your patient's EKG readings? How is it going to change their symptoms and things like that? One thing that I find a lot is how to maybe not necessarily identify a myocardial infarction, which is a heart attack, but they stress MONA a lot. So that would be morphine, oxygen, nitro, aspirin. And also you need to know how often they can take their nitroglycerin tablets and how to store them. That pops up a lot. And then a patient with a head injury is another one that I see a lot. You know, if they're in the hospital and they've got a head injury, usually you want the lights off and you want a low stimulating environment. And then isolation precautions. You need to know, like, for example, measles. Is measles airborne droplet contact? How are you, what kind of positive or negative pressure room are you going to put the patient in, and things like that. Okay, so I wanted to show you guys one more thing that I use to study, and it is UWorld. So this is their website, and if you click on it, you can go to nursing, and you want to pick NCLEX-RN, and it's going to take a second to load. But this website has a lot of practice questions on it that I just find really helpful. And then if you scroll down, you can see kind of the description of what's included. It has a little over 2,000 questions, which I find super helpful. But then it also has the rationales again, so I learn better when I understand exactly why I got it wrong. And then the cool part is that you can also customize your exams. So like I said earlier, I don't want to review every single thing again, just the things that I'm not doing as great with. And then it gives you some diagrams and stuff too for the explanation, so if you're a visual learner, that's really great. So the package that I have, if you look at the bottom, there's a couple different options with certain day-long accesses. So the one that I have is the 90-day access, because I'll be taking my NCLEX a little closer to June. Thanks again for joining me on my channel. Don't forget to like and subscribe if you found this video helpful, and if you got some tips and some ideas